All right. Good afternoon, everybody. Thank you so much for joining us. My name is Kathleen Donovan, and I'm one of the coordinators at the Special Education Parent Resource Center. I work here along with my colleagues, Gina DeSalvo and Emma Paral Sanchez. Emma, would you like to just share that people can choose to listen in Spanish and welcome people in Spanish?
Buenas tardes, buenos días, buenas tardes. Si necesitan interpretación al español, por favor en la cajita del chat, avísenos porque tenemos a nuestro traductor. Muchas gracias. Okay, Kathleen.
Great, thank you. We're so happy that you joined us all today for this very important topic that we were asked to co-sponsor by our Office of Student Services. We will be recording the session and we encourage you, if you have questions, we've had some folks submit them in advance, but you're welcome to use the Q&A feature and we will go ahead and share some hopefully answers to those questions toward the end of the session. Just a little bit about the Parent Resource Center. If you're not familiar with us, we are part of Arlington Public Schools. And while we sit within the Office of Special Education and support many families of students with disabilities, we welcome all families to access our supports and services, which include individual consultations to help families navigate the special education process or know how to connect and collaborate with the staff at your schools. We connect families with lots of school and community resources. We're very fortunate in Arlington to have a resource-rich community, so we love working with our community partners and love connecting families with them and with other families. We also offer lots of parent learning sessions like this. Many of them indeed are about disability-related topics, but a topic like today we know can impact many families and many students. So this is an example of one of the many learning sessions we offer each month. And then we have a lending library. We have lots of great books here on disability topics and other parenting topics. So we've got books on things like autism and anxiety and ADHD, but we also have books on, sibling rivalry and how to help kids get their homework organized, etc. And in addition to the physical books, we also have now electronic and audio books. So you can learn all about that on our website, which is apsva.us/PRC. You'll see that on your screen here, and I'll also put it in the chat. And then to keep up to date with what's happening at the Parent Resource Center, if you don't regularly get our school talk messages and you'd like to, you can use this QR code.
Okay, thank you, Kathleen. Yes, and I want to thank the Parent Resource Center. Thank you so much for partnering with us and Student Services to put on this recorded presentation for the APS community. And I'm really, really pleased to see all these participants on the call. And it's a very important topic that we're going to be discussing today. So we're happy to see this. Again, my name is Dr. Kristen Devaney. I am supervisor of student services. And so I support our substance abuse counselors here in APS. We have a team of 6 substance abuse counselors that serve all of our schools in APS. And today we're going to be hearing from our Miss Jenny Sexton, and she's our presenter for today. So I know that for those of you who registered, you had an opportunity to put some questions in ahead of time. So we'll be able to answer many of them during the presentation and during the time that we have allotted today. So with that, I'm going to turn it over to Miss Jenny Sexton.
Thank you. Thank you again, everyone, for showing up today and learning about this important topic. So we are going to be covering a good amount of information today. So we're happy to share a copy of this PowerPoint with anyone who would like a copy of it after we're complete. So I'm Jenny Sexton, one of the substance abuse counselors with APS, and I support all of the elementary schools and also Kenmore and Williamsburg middle schools. Yeah. All right, so for our agenda for today, we're going to talk about fentanyl and the illicitly manufactured fentanyl. We'll talk about the difference between fentanyl and heroin, which we're not seeing much of right now in the state of Virginia. So we'll talk about why that's happening. We'll talk about counterfeit pills, the availability, utilization, cross-contamination, the overdose epidemic, and we'll finish out talking about naloxone, commonly known as Narcan. So first we'll talk about fentanyl. So In this presentation, we'll talk about two different types of fentanyl. So legal fentanyl, which would be medically prescribed fentanyl, prescribed by a doctor. And then next we'll talk about the illicitly manufactured fentanyl. So the medical fentanyl or the legal fentanyl was developed in 1959, and it was introduced in the 60s as an anesthetic. So we know that this is a powerful synthetic opioid that's 50 to 100 times more potent than morphine. And it's commonly prescribed for individuals post-surgery or for individuals who have an ailment that has severe chronic pain related to it, such as cancer. We know that legal fentanyl is prescribed by a doctor, and it can be prescribed as a lozenge. It can be prescribed as what we call a lollipop, or a substance that goes into the mouth. It's a swab or tablets, or there's also sprays and pain patches. So as we mentioned previously, the legal fentanyl is commonly used for individuals who have issues with severe chronic pain or ailments where there's chronic pain associated with it, such as advanced cancer, different chronic pain type ailments, and then following a surgery. So oftentimes when someone has a surgery, they will prescribe fentanyl immediately post-surgical procedure because it is very strong and they want an individual to rest and relax post a surgical procedure. And if they're up moving around post-surgery, that could cause some type of additional injury or some type of other injury related to their surgery. So they want people to be in a relaxed state post-surgery, which is why they will commonly prescribe fentanyl following that surgical procedure. Illicit fentanyl is fentanyl that's created in a clandestine lab. So as we commonly say, someone's home lab. So it's improperly manufactured and it's found in different forms that's being marketed in liquids and powders and being added to the counterfeit pills, which we'll talk about shortly. We know that some of the common mixtures include heroin, cocaine, meth. There's also something called xylazine, which we're seeing, which is an analog of fentanyl, and it's an animal tranquilizer. And then there's something called eutalones, which are synthetic bath salts. And we're commonly seeing that added into this combination. And then they're creating these combinations into the counterfeit pills. The counterfeit pills are being made to look exactly like prescribed opioids and other medications such as amphetamines or benzodiazepines. So the illicit fentanyl is dangerous. We know that it's being created in these clandestine labs in places like Mexico, China, and India. And we know that it can be found in nasal sprays, eye droplets, and then also dropped onto a small piece of paper or even into candies. So fentanyl versus heroin. So in 2017, we really started to see fentanyl kind of make its appearance with heroin. So initially in the state of Virginia, we were seeing a good amount of heroin as the opioid crisis emerged. And then as time has passed, people were seeking stronger opiates and opioids to intensify their high or to make themselves feel much different or a much more powerful high when they're utilizing these opioids. So we knew that fentanyl was starting to be added into the combinations with heroin, which is an illicit substance. So since 2017, we've kind of started to see heroin decrease in the state of Virginia and the use of fentanyl increase. So we really see minimal amounts right now of heroin in the state of Virginia, and most of the opioid that we're seeing that's linked to the overdose is fentanyl. So again, as we mentioned, fentanyl is synthetic, so it is man-made and is 50 to 100 times more potent than morphine, versus heroin, which is derived from morphine. So when heroin crosses the blood-brain barrier, it actually converts back to morphine. As we mentioned before, fentanyl comes in either a liquid or a powder form versus heroin, which can be powder or a black tacky substance, which is commonly called black tar heroin. We know that heroin is classified as a Schedule I substance, meaning that there's no medical use for it and has the highest potency for addiction on the DEA schedule list. We know that both substances can be injected, smoked, or snorted, when they're utilized. So if you're looking at the difference here, so before you have a fatal overdose or a fatal dose of heroin and what a fatal dose of fentanyl would look like. So next we'll talk about counterfeit pills. So we know in 2022, between Washington, Maryland, and Virginia, over 160,000 counterfeit pills were seized from the Triad area. We know that there was 8 million, enough fentanyl seized rather to kill 8 million people in the area. So we know that this is here. We know that these counterfeit pills are in our county, but we know that this is a United States issue. So this is happening across the United States. So counterfeit means fake. And so these are fake medications that have different ingredients than the actual medication. They may have no active ingredient, or they may have things like heroin, the illicitly manufactured fentanyl, utilones, xylazine, cocaine, crystal meth. It could be any number of different substances. We know that these production is occurring mainly in China, Mexico, and India. And we know that there's an increasing number of pills that are being laced with fentanyl that are now being produced with drug trafficking organizations. So essentially what happens is a lot of these pills are being created in Mexico and then sent over to China to add their chemicals. And then they're being purchased through different websites, so different dark web websites, and our adolescents and adults are actually accessing these through a variety of different social media platforms. So this is just an example of what a fake or counterfeit pill looks like versus the real substance. So again, if you don't have experience with these substances, or even if you do have experience with these substances, you may not necessarily be able to tell the difference. When, these are pictures we've pulled from the internet. So it's, whenever we go over this with our students, they'll try to, look at it with the different, sizes or shades, that type of thing. But in reality, most individuals in our schools have never seen opiates and opioids in person, or an Adderall, which is the center pill, or a benzo, which is to the right, and that would be a Xanax along with the counterfeit Xanax. So in actuality, they may really have no idea what exactly they're looking at or about to consume. So the thing we're seeing most commonly right now across Northern Virginia are the blues or the M30s. So these are pills that have one side is stamped with an M and the other side with a 30. And these contain illegally manufactured fentanyl. However, the amounts is unknown, so we often don't know what amount of fentanyl or other substances are in the pills until someone ingests them, and then we see some type of medical emergency. These are commonly passed off as oxycodone or Percocet 30s, or commonly called Perc 30s. So again, authentic versus fake. So when you look at these two, depictions, it's very difficult to tell what would be authentic and what would be fake. So when an individual is purchasing an opiate or an opioid online or from another individual, they're not purchasing these pills with the intent to cause an overdose. They're purchasing these substances in an effort to become high or feel different, or as we commonly describe, that quick euphoric feeling that someone would experience when they utilize an illicit substance. So it's not intentional, but unfortunately, again, the only way to really know what are the contents of these pills is when it's ingested, and a medical emergency could potentially, occur following that. So again, just some examples. What we've seen more commonly in Northern Virginia is individuals that are smoking the Perc 30s. So essentially what they do is they purchase 2 pills, and the pills are about $10 a piece. And then they'll heat up the pill underneath of the foil, and then they'll use some type of straw or smoking device and hold it over top and utilize the substance in that manner. So the availability of illegal fentanyl, so this is a little bit eye-opening and pretty scary. So the illicitly manufactured fentanyl is very inexpensive. We know that an ounce of the fentanyl costs about $2,000 to $2,500. So we know an ounce equals 28,000 milliliters or 28,349 doses. So a gram of fentanyl on the street will cost between $150 and $200. One single 100 microkilogram to 400 microkilogram dose of fentanyl is about $2 or less. There's also something called a gel cap that is heroin mixed with the fentanyl, and that costs between $3 and $6. And this information was provided to us by our partnership with HIDA, which is the high intensity drug trafficking folks here in the Delmarva area. So when it comes to the utilization, as we mentioned, the different methods of use. So fentanyl analogs come in several different legal forms, such as powder, patches, tablets, and spray. So the legal fentanyl is commonly taken by mouth. It's given intravenously by a doctor or via a patch. The illegal fentanyl or the illicitly manufactured fentanyl is often taken by mouth, smoked, snorted, or it can be injected as well. So overdose is unfortunately seemingly more of a common occurrence with the counterfeit pills and the illicitly manufactured fentanyl. So we know over 150 people die across the United States each day from overdoses related to opioids like fentanyl. Some of the symptoms to look for are the small constricted pinpoint pupils. Okay, so the pupil will be so microscopic it would be hard to see. Someone falling asleep or losing consciousness. So that would be in more of an atypical setting, such as like if someone's at a basketball game and there's a lot of noise around them and they're falling asleep, or commonly what we would call nodding out. Please understand, if someone is to the point of nodding out, then that means that an overdose is looming. So we want to monitor that situation very, very closely. An individual may demonstrate slow or shallow breathing. They may be gasping for air, or they may sound as though they're snoring. They could sound like they're choking, or there could be gurgling sounds. Their body could be limp, and they may be pale, blue, gray, or have cold skin, which really means that they're actively exiting out of life. So we really need to get them medical attention as quickly as possible. So one of the hardest things about someone when they abuse opioids is withdrawal. So withdrawal occurs within about 6 hours of the last dose of the opiate or opioid. And this is why folks have a hard time discontinuing the use of these substances, because the withdrawal is intense and can last anywhere from 5 to 7 days. And it can be in the form of anxiety and agitation, sleeplessness. They may have body aches and pain, abdominal cramping, high blood pressure, rapid heart rate, nausea, vomiting, chills. So it's almost like a bad case of the flu for that period of time. So another concern is the cross-contamination, and I mentioned some of the substances previously, like the xylazine and the utilones, but when fentanyl is being mixed with these other substances, it increases the risk of overdose exponentially. We already know that the illicitly manufactured fentanyl is very dangerous, and then when we add highly potent substances to it, such as a xylazine, which again is an animal tranquilizer, or a utilone, which is a synthetic substance, or even heroin, we know that that increases the intensity of the substance, and in some cases could even make it Narcan resistant or naloxone resistant, meaning that they may not necessarily respond to the naloxone for the first dose or within a period of time. So first is the fentanyl-laced cocaine. So we know cocaine is a powerful stimulant substance. So for interstate, stimulant substances speed up the heart rate and speed up the breathing and respiration unnaturally. So essentially cocaine forces the heart rate to speed up, which is why people have a false sense of energy for a short period of time. Fentanyl and illicitly manufactured fentanyl and opioids are depressant substances. So that's an unnatural decrease of the heart rate and decrease of the breathing and respiration. So mixing those together can really, one, cause some confusion of your central nervous system, but two, it can increase the intensity of the substance. Next is the fentanyl-laced heroin. So again, these are both powerful opioids. So as mentioned before, heroin is made from morphine. And when it's refined, it can become very, very addictive when it's injected, smoked, sniffed, or snorted. So adding fentanyl to that exponentially increases the risk of overdose, and that is because of the intensity and the strength. Sorry about that. Having a moment. Here we go. So next is the xylazine. So xylazine, as I mentioned a couple of times, is a pharmaceutical sedative for animals. So for large animals such as horses and cattle. So we know that this intensifies the effects of the fentanyl, again, exponentially, and oftentimes can lead to a quick overdose. We also know that in addition to xylazine and fentanyl, it could have other substances such as benzos and even alcohol, which increases those likelihood of overdose death. All right, so utilone's mixed with fentanyl. So as I mentioned before, utilone is a powerful stimulant substance. So it's a psychoactive bath salt. So I don't know if folks recall, but several years ago, we saw the substance bath salt come out on the market. And so at the time, bath salts was very cheap, and it mimicked the effects of things like methamphetamine. And it was legal at the time when it first came out. So this is not the same type of bath salts that we put in the bathtub, but again, this was a illicit substance that was synthetic when it was created. So we know that the utilone is a stimulant, okay, and it was a compound designed in the 1960s. However, it was initially created as a designer drug, but never approved for any type of medical use. So we know that this is cheap to produce and mimics the effects of things like cocaine, methamphetamine, and ecstasy. And it can come in powder, capsule, or tablet form. Okay, this is also classified as a Schedule I substance. So with the epidemic of overdose, we know that in 2019, 36,000 people died of synthetic opioids. We know that drug overdose deaths reached 100,000 for the first time due to fentanyl. This is a record high, and it's the deadliest it's ever been. So if you look at the statistics between 2016 and 2021, it's gone from 56,000 to over 100,000 deaths. So next we'll talk about naloxone, or commonly called Narcan. So what is naloxone? So this is the only fast-acting remedy for an opioid overdose. It works on any type of opioid, including heroin, fentanyl, Demerol, and even OxyContin. However, as mentioned before, there are some analogs of fentanyl, which we do have some concerns as to whether or not naloxone is resistant to those substances or could potentially require more doses to bring the individual out of an overdose. We also know naloxone will not reverse the effects of any other substances such as cocaine or benzos. However, if somebody were to mix those substances and there was opioid in the substance, then the naloxone would work on that particular substance. So for example, if the fentanyl was mixed with cocaine, it should work to bring somebody out of the overdose. But much like with other things, it's no guarantee. So we want to make sure that that's clear. We know that naloxone, if it's going to work, will typically work within the first 2 to 3 minutes. However, if it does not work in that period of time and emergency services have not arrived on scene yet, then we would want to give a second dose, which we'll talk a little bit more specifically about next. So an overdose essentially occurs with opiates and opioids when the opioid receptor becomes so inundated that it no longer can work. So the opioid receptor is your pain messenger. And so when someone has surgery or some type of injury that requires an opioid, that opioid receptor, when somebody utilizes the medication, that receptor is covered up. So individuals may still feel some sense of pain, but it may take, most of the pain away, which technically the pain still exists, but that receptor is being covered up. It's almost like an umbrella, so the individual is not experiencing that pain. In the process, it slows down the heart rate and slows down the breathing and respiration because it's intended for somebody to relax after surgery or some type of an injury. So when that receptor becomes so overwhelmed that it can no longer do its job, we start to see the symptoms of an overdose, which would start with something like nodding out. And when the body is starting to try to come out of this, that's when we'll start to hear the gasping for air or the snoring or the gurgling sounds. So that's the body trying to rebound from what it feels like it's actually dying. So the body's trying to recover from that. So as we previously mentioned, some of the symptoms of an overdose. So again, this is important should you encounter somebody who you believe to be in an opioid overdose. The constricted pinpoint pupils, the falling asleep or loss of consciousness, the slow, shallow breathing or gasping for air, the choking or gurgling sound. They may be limp, or again, they may be pale, gray, blue, or cold. So again, this is the body trying to, in some states, come out of that situation because it feels itself starting to shut down. So the lungs are going to try to rebound, which is where the gasping for air will occur. And then the heart rate's going to try to rebound because it feels itself slowing down to a dangerous level. So what we want to do in an opioid emergency is we want to survey the scene. So we don't want to rush up to the individual, but we want to approach with caution to assure that there's no live wires, there's no needles, or anything like that near the person's body. We don't want anybody to, find themselves in a dangerous situation should they encounter live wires or a needle that is exposed. If you have gloves accessible, please make sure and put on gloves. We as APS are providing masks for all of our staff and gloves because there is rescue breaths that is involved in this. You want to check for responsiveness. So if you know their name, shout their name. If not, tap their shoulder, pull their ear, give a good little tug, give a sternal rub. So put some pressure behind that sternal rub because if somebody, again, is able to react or respond to that, then we don't want to administer the naloxone or the Narcan. We want to just observe that situation. We want to carefully look, listen, and feel for breathing, okay? And we say carefully because as you lean down, if that person is not in an overdose, but say there's another substance in their system or they're, not in an overdose state at all, they may lift up and then you could potentially get head-butted accidentally, and we don't want anybody to get hurt. We want to go ahead and contact 911, okay? Once we recognize that this is likely an overdose situation, we want to call 911. We want to let the 911 operator know that we believe this is an overdose and that we are trained to administer naloxone or Narcan, and we're preparing to administer our first dose. So what we want to do when we are administering is we want to lay the person flat on their back. You want to gently tilt their head. That way we know the full dose is going to get into their nasal cavity. Remove the naloxone from the box. We want to hold the naloxone with your thumb on the bottom of the red plunger or a white plunger, depending upon what type of brand you get. And you're going to deploy the plunger until it snaps. Okay, so put it up the nostril and push it and it'll snap. It'll be a little pop. Okay, so again, gently tilt, put the plunger up the nose and push the plunger until a little snap or a little pop happens. And you've just deployed your first dose of Narcan. Next, you're going to use your mask if you have it. So again, we want to make sure everyone understands that rescue breaths is part of this, but not everyone may be comfortable with this. So if your comfort level is just administering the Narcan, then that's okay. But if you have a mask and you're comfortable administering those rescue breaths, please do that, okay? So you're going to place the mask over their nose and mouth. We want to pinch the person's nose gently and give one breath every 5 seconds for about 3 minutes or until EMS arrives. If the individual still is not conscious and EMS hasn't gotten there, we're going to give our second dose of Narcan or naloxone and start the breathing cycle again. Understandably, most individuals will recover after the first dose is administered. However, they also are going to be pretty agitated when they wake up. Okay, they're going to wake up pretty abruptly. So if you start to see any movement, please go ahead and get up and get out of their way, because they're going to be agitated. They might not feel very well. They're not going to thank you for saving their life, but instead they're going to be irritable. Because when we bump that opioid off the opioid receptor, which is what we do, and when we administer the naloxone, then that's going to put them into withdrawal. And that's why they are going to be a little bit more agitated and irritable. We also want to caution people that individuals may not stay there. And if they want to leave the scene, we don't want you to stop them, because we don't want anybody getting hurt. So when you're on the call with 911, give 911 a description of the individual if you can, and also if they leave, what direction they go. This is important because there is a risk of going back into an overdose within 30 to 60 minutes. The naloxone is not intended for long term, it's actually short term. And so there is a risk that that opioid could return to the opioid receptor, so it could reattach. So if EMS gets another call later in the evening, they'll know that that individual's already received naloxone. Some important reminders about naloxone: you should store it below 77 degrees. We don't want to have it in our vehicles if it's above freezing or below freezing. We want to make sure that it's not excessive heat or excessive cold. We want to keep it in the box until it's ready to use. The box will also have an expiration date on it. So we want to make sure that it were to be replaced before it expires. We want to keep it out of reach of children. It's not harmful at all. And if a child were to access it, then it wouldn't hurt them. It would just burn their nose. But because there is a cost associated with it, we would rather it not be wasted. So for those in the community that are interested in getting any Narcan, medication deactivation bags, medication lock boxes, you can certainly scan this QR code and access that through our county partnership with DHS. School folks are accessing it through us. We've proudly trained more than 1,500 staff, and we have more than close to 800 doses of naloxone in our elementary, middle, and high schools. And we continue to administer the doses even today as we speak. So now we will open it up to questions.
Thank you, Ms. Sexton. I'm going to go ahead and share some questions
Sure.
that were submitted during registration. And so the first question is, are there any virtual trainings available on how to administer Narcan? And so thank you for going through the naloxone training. And I know that you mentioned the resources that our county offers, but if you want to respond to the trainings, the virtual trainings they might have.
Sure. So the Arlington Addiction Recovery Initiative is a great website to take a look at. They post all of their trainings there. They're doing several trainings each week in an effort to get more of the naloxone out into the community. There's also the Chris Atwood Foundation, where individuals can go and do a brief training and also get free naloxone through that entity as well.
Thank you. There was also a question about where families can access Narcan to have at home for an emergency. So thank you for sharing.
It's also available in the pharmacy. There's a standing order in the state of Virginia where individuals can use their insurance and pay the copay and actually access it through their pharmacy as well.
Thank you. At what grade does student prevention education begin at the schools?
Sure. So we start our student education in 4th grade. So we do 4th grade through 10th grade. And then students in 11th and 12th grade have more individualized presentations via their classroom settings.
Thank you. How young are you seeing cases of abuse? And what examples or instances can families learn from on how to best educate 2nd and 3rd graders and other parents?
So I think as far as the parent piece goes, utilizing the resources we're providing via PTA meetings, having these conversations with their student about what they know, what they understand, what they're hearing about is all very, very important. All of the health lessons through health and PE have information also, starting very young and kindergarten and 1st grade, they have, the substance use prevention information. As far as cases that we're seeing, fortunately, we're not seeing a significant amount of opioids in our schools directly. Most of what's happening in the schools is happening outside of the schools, and then our students will report to their substance abuse counselor or their counselor, to other trusted adults within the building, that they've tried these substances or utilized these substances. So it's really difficult to say age-wise because, most of it is not coming into our school directly. It's coming in via other venues.
Thank you. Can you speak to a family is asking, can we get notifications when drug-related issues are uncovered in a school or when police is called?
So I think what the individual schools are doing is there's typically a school talk that gets sent out if there is a substance related issue. We're not allowed to provide specific details in many capacities because substance abuse is bound by federal confidentiality regulations. So we can't share age and that type of thing. But I do believe that the principals will put out specific information via a school talk as far as an incident occurred, and helpful tips on how to navigate that with your students, at home and resources that are available.
Can you talk a little bit about the availability of the beds in the local treatment centers?
So this is definitely something that has been hard for us. And within the community, there's not a significant number of resources for our adolescents as far as treatment services. So we are working on improving that and getting more access to resources. So we can take our families through the FAT process and work on getting funding for that. So we're really exploring all of our options throughout the state in an effort to be able to get our students treatment resources that they may need.
Thank you. A family is asking if you can recommend any books or other resources to help guide conversations with tweens about drugs.
Sure. So there's definitely SAMHSA has some good resources. NIDA is good. If you take a look at our substance abuse counseling page on the APS website, we have lists of resources there as well. And you can always reach out specifically to your school substance abuse counselor, and we can also help guide those very difficult conversations. But I can tell, even in my elementary presentations, that you all as parents are having really good conversations with your kids because they're, they know about fentanyl, they know about the dangers of these substances. So, parents are having really good conversations. So I would encourage those conversations to continue.
Thank you. There's a question here about fentanyl test strips, and if you could talk about how those work.
So with the fentanyl test strips, essentially what happens is a small piece of the pill would be put in like a small cap or like a bottle cap with water. And then the test strip is simply dipped in there. And then you wait 2 to 5 minutes and it will tell you whether or not that were to contain fentanyl.
And it looks like this question might have come when you were talking about the naloxone training. If you could talk about what a breathing mask is.
Sure. So a CPR mask is just a barrier that we offer to our staff, because the individual may have, vomited or any type of residual substance around their mouth. So we again want to ensure the utmost of protection for our staff. So it's essentially like a barrier mask that covers the nose and the mouth and would protect an individual from any contents that may be around the mouth or nose.
There's a couple of questions here, so I just want to about the slides, and families are asking if they can get a copy of the slides here. So yes, Ms. Sexton will be able to share that. And we do have some time for some more questions, and these are all really good questions. And feel free to just put that in the chat and I can read them out loud.
I'm going to put my email in the chat if anyone would like a copy.
And I think because we're using a webinar format, the chat is disabled, but please post questions in the Q&A section and we'll be glad to answer those. And I know that I do apologize, the subtitles did block some of the slides. We're going to reshare Ms. Sexton's previous slide at the end of the Q&A that had the QR code, and I'll turn the subtitles off so that you can all get to that QR code.
Thank you for clarifying, Ms. Donovan. There is a question here. Are you seeing instances of fentanyl being mixed with pot?
We are hearing more and more reports from our juvenile probation officers that adolescents who are on probation of some form are testing positive for fentanyl when they are denying fentanyl use, but admitting to marijuana use. So we are starting to hear about more cases of that.
I also want to make sure that we share our link to our substance abuse counselor website on APS. So I know Ms. Sexton is going to share her contact information, but so you can also see the substance abuse counselors who may work at your student school. Reach out to them as well. So there's a question being asked if the APS book resources can be included as well.
Yes. There's an extensive list on our website specifically, so definitely encourage everyone to take a look at that. And it will also give the specific substance abuse counselor for the specific student school as well.
Can you provide any guidance in how to approach conversations with elementary level kids, for example, third graders?
Sure. I would always start out with asking the student, what do you know? What have you heard? Do you have concerns or fears? Many students have obviously heard about the Wakefield incident. So starting off the conversation with, have you talked about this in school? Do you have fears? Do you have concerns? We've actually started our elementary lessons opening up the floor for our students to ask any questions about concerns or fears they may have, and helping them feel safe and protected, and helping them understand that they are 100% safe in our schools and that we have staff that are trained to handle all medical emergencies. So continuing that conversation at home, helping your child understand, not to take medication from anyone other than a trusted adult, helping them understand how to read a medicine label. That's one of the things that we focus in on our 5th grade lessons, is helping a 5th grader understand the different aspects of a medication label and how they should only take medication from their trusted adult. And that, if they get something that is opened or not from a trusted adult, they shouldn't touch it, they shouldn't take it. So really continuing those conversations is great. And, I'm also happy to share any of our lessons that we go over with our 4th and 5th grade students to also help guide those conversations.
It's helpful. Thank you.
Sure.
How would you report if you witnessed substance abuse?
So we, if it's a student in school, we tell them if they see something, say something right away. It's very confidential. If it's something in the community, we would encourage the individual to contact the school administration immediately. If it's, not during school hours, contact the police and let the police know what's been observed. Because of our concerns about especially these counterfeit pills, we want, our response to be expedient and really work to prohibit, anybody from being harmed.
Thank you. We have time for a couple of more questions.
Dr. Devaney, are you able to put our website in the chat? I don't know if folks can see the chat.
Yes, I'm going to enter that in there as well.
I think one of the things I would definitely encourage is folks to come to PTA meetings, come to the different community events that we're having. I mean, that's really, really important to be able to have those conversations. I know I'm scheduled for numerous elementary PTA meetings up and coming. We've presented here at Williamsburg. We've presented at Kenmore. We have some more stuff up and coming at Kenmore. So really attending those meetings and getting the opportunity to get to know your school staff, get to know your school substance abuse counselor, really start to build that relationship and just be able to ask these important questions as well.
I'm seeing some comments of gratitude, so thank you. Thank you for this, Ms. Sexton. I'm going to put our website in the chat. Also, I know that you spoke about naloxone, but if you want to maybe talk about the cabinets, the naloxone cabinets that have been
Yes.
installed.
So all of our secondary schools, so our middle and high schools are in the process of getting emergency naloxone cabinets placed. So they would be on each floor of the building. And so, for example, if a school has 2 floors, they would have 2 boxes. They'll be near the AED in most cases, and they will each have a dose. And you can see the kit right before you. And so, although our students are not permitted to carry naloxone, we want to highlight that is accessible for staff should they choose not to carry naloxone, which is their choice, or for staff that it's closer to gain access to that dose than their own. We do encourage staff to keep theirs with them if they're, moving through the buildings as we do. Also want to highlight to our safety and security staff have all been trained as well. In safety and security, the SSCs are in the middle and high schools as well. And so they are also carrying naloxone. So we have a significant amount of naloxone in our buildings and more to come. And we've all staff have been required to be trained. So next our focus will be on, going through and making sure everybody's completed their training and has their doses of naloxone to administer.
Okay, it looks like you have answered all of the questions. So we certainly appreciate that and certainly appreciate everyone who is participating in our discussion today. These were excellent questions. I did put our website in the chat, but I know Ms. Donovan, you said it might be something that not all participants can access, right?
They can see it. So you should all have that, but we will, after the session, we'll send you all a link to the recording and to all of Ms. Sexton's wonderful slides. And we will send you these other links we've added. So you don't have to be looking back through your notes, but thank you. I do see that in the chat. And I'd like to thank Dr. Devaney for organizing this session today. And thank you, Ms. Sexton. I know I learned a lot. And I think that's certainly the nature of the comments we've heard is that people found it very helpful. All right, well, thanks, everybody. You should have, when we send you this, you'll have a link to the Parent Resource Center email. So if you have suggestions for other topics or would like to learn more about this topic or have other questions, please let us know and we'll do our best to try and meet your needs. But I'm very pleased that our community is coming together on this important topic and learning together how we can support our children. So thanks so much, everybody, and we'll hopefully see you at a future session. Bye.
Thank you.